In Xinjiang, officials say they have contained a new outbreak of COVID-19. A key step in achieving that was finding those who were infected before they developed symptoms. 23 people who had already tested positive for the disease developed symptoms on Wednesday. The total number of confirmed cases remains at 183, all in one county in the Kashgar prefecture. The outbreak began Saturday when a teenage girl was diagnosed, prompting health authorities to test more than 4.5 million people. For more on this latest outbreak, let's talk to Richard Cheng. He's a U.S. doctor who has treated coronavirus patients in Shanghai. Good to see you again. So what do you make of these latest cases in Xinjiang, and what is behind them? What's happening there?
Yeah, thank you, Elaine, for having me again on the show. I'm not surprised at all. I think I've mentioned in my previous show presence on this program that focal and local outbreaks like this will happen and will continue to happen. And we may not know the exact source of these infections. They may come from person to person spreading, or they may come from imported goods, and because COVID-19 is still a pandemic worldwide, and so I'm not surprised. But what I think the government has been doing is quite impressive by mass testing a large number of people, those people who have come into contact with potential infection sources. And that's pretty rapid and pretty effective. And I think worldwide governments can learn a thing or two from what they are doing here.
Despite how China has controlled this outbreak as well as other countries across Asia, what do you think are the biggest concerns when it comes to this pandemic and these new outbreaks?
Well, one of the problems I see here is that, to me, COVID-19 is like a war, a different kind of war. So we should all focus on how to get the COVID-19 contained rather than the infight that we see worldwide, particularly probably in the United States. They've been politicizing this event, and so that's the key. So we all should take necessary measures, and we should all have some sort of personal sacrifices. Basically limiting your movements and social distancing whenever possible, wearing a mask if it doesn't bother you that much, and don't go out if it's not necessary. These are very easy to do things that we should do. But in addition to these other things, I've been saying here is that a lot of other lifestyle medicine approach, nutrition, have been proven and sufficient scientific data to support they are pretty helpful. For example, I'm about to travel back to the United States next week through Europe. So I'm going to take like vitamin C, vitamin D, zinc, hydrogen peroxide, and melatonin. These are all have plenty of scientific data to support their effectiveness. So these are the things inexpensive, convenient, and easy to do. So let's do them,
Boost your own immune system. Yeah. So that being said, what is your outlook for the fall here and the coming winter in China? How are people feeling there? Well,
be honest, I've been here in China this time for over 10 months now. I would say pretty much life has gone back to, as normal as possible, with all things considered. And I don't really sense nervousness or panic in the air wherever I travel. I've been traveling a bit in China, and when the cold winter comes, and we may see some more outbreak mixed with the common colds and the influenza. But I don't think I'm not too worried here, at least in China. But worldwide, we need to take necessary precautions.
All right, Dr. Richard Cheng, thank you so much for joining us there from China.
Thank you for having me again, Elaine. Thank you. Bye.